Great. Thank you very much. We're on to our sixth and final speaker, Anthea Burnett from IAPB. And you're going to talk to us a bit about some latest developments on Vision Atlas.
Yes. Hi, everyone. So today I'm talking to you about data science and the role of the new IAPB Vision Atlas and how it can be used for evidence-based decision making. So we've had a Vision Atlas for about a decade now. I think some of you would probably remember that manual, that atlas that you could hold in your hand, and it was a really, really exciting development when that was launched. After that, there was a website that had some fantastic maps, and then when the Global Burden of Disease and the Vision Loss Expert Group released new stats in 2020, we did another redevelopment of the Vision Atlas where we brought in more country dashboards and some more visualizations. But now I'm really excited to say for the very first time that we have a new Vision Atlas. So this is a pre-launch. The actual soft launch, we've been very staggered in our rollout here with websites. There's lots of bug testing that needs to happen. So this is a pre-launch of the soft launch, which will be on Thursday. But I'm so excited to be able to share this for the very first time. It's so new, in fact, that when I prepared this presentation, the home screen didn't look like that. So it's been redeveloped further. But it's really exciting to be able to present this. So the aim of the new Vision Atlas was to be able to better demonstrate progress. We wanted to be able to track global and national progress better and have the infrastructure to be able to incorporate that data and share that data with the sector. We wanted the Vision Atlas to be accessible. We wanted enhanced visualizations. We wanted to be accessible for people with vision impairment. We wanted it accessible for advocates, for researchers, for communications people, for policymakers. And we wanted it to be really insight driven. We wanted to be able to translate complex data into insights for policy and planning, but still have that rich data available for academics and researchers who love to get into the details. So some of the challenges that we've had along the way is navigation. I often heard that the previous Vision Atlas was a bit hard to navigate. You would get lost. It was a bit hard to find where you were, and you remembered you saw that visualization, you couldn't quite find it again. So we've really tried to improve the navigation and make things simpler in navigation. Another problem we had with the previous Vision Atlas was recognition for data producers. We often found that people were citing the Vision Atlas as a source of data and not the original data provider. So instead of people citing the Vision Loss Expert Group or RAB studies, they would cite the Vision Atlas, but the Vision Atlas didn't collect the data. So we've tried to make it really clear the citations for how to cite data appropriately. Another issue we tried to resolve with the new Vision Atlas was agility. Previously, if there was a new piece of data that came to us, we just didn't have the budget to employ our web developers to create a new visualization. So we've really tried to be dynamic and have a pipeline for us to be able to input new data as it becomes available and respond when there's new research. So these are some of the visualization tools that we're using. We're using a product called Flourish, which has a whole range of visualization tools for people who love building charts. It's a great way to spend your day. So coming on to the lessons learned, we learned that our user needs really vary. We've got academics who they want all the data, and we need policymakers who just give me the top 3 findings. So in our country pages and in our global dashboards, we've got a really high level overview of this is the issue, this is how much it costs, and this is how we're making progress. And then if you scroll down, we've got all as much data as we can incorporate into our data global and country dashboards. As I said, we're trying to be really clear on data use and how to cite the information, where it comes from. Is it globally modelled data or is it country nationally collected data? So being really transparent about where the data comes from and what it actually means in terms of the data quality. We really wanted to widen the data net. Previously, the Vision Atlas is really focused on Vision Loss Expert Group data, which is incredibly valuable. But we wanted to include more data sources. So we've got 65 plus new data sets being incorporated now. With the visualization tools, we're going to be able to do more to show progress over time rather than just a static sort of snapshot of time. And as I said, we really wanted to acknowledge the contributors. So the core contributors that we're drawing on is RAB World, like the 390 surveys. That has been an incredible effort by the sector to consolidate and present the burden of vision loss. And then the vision loss expert group uses that to model data, globally model data for all countries in the world, drawing heavily on the Lancet Global Eye Health Commission as well. So the new features is a scalable data pipeline. So as I said, if we ever got a new piece of data, we just didn't have the budget to employ the web developers to add that new line item and update the citation. But now if someone comes to me and says, actually, the number of ophthalmologists in Afghanistan is this, and here's the report, we can update that on the country dashboard today and have it on the Vision Atlas tomorrow. As I said, we've got a whole range of new visualization tools. So we've got data stories as well as some complex data explorers that we can employ. And we're also doing some data collection around progress towards 2030 Insight using some simplified questions that draw on XATs and eye care indicator menu. And we've got that data collected for 50 countries now. As I said, one of the key features is expanded data, broader data sets. One thing we really heard from our users is that people wanted expanded country dashboards. So we've included a lot more information on our country dashboards around workforce and effective coverage. And as soon as the new effective refractive error coverage results that are in progress, as soon as they're published, it'll be really exciting to be able to use that publication and update the Vision Atlas so it's always up to date. So that speaks to being flexible, so we can be much more responsive to sector needs, and enhance visualizations, ability to tell data stories and communicate insights more clearly. So we think the outcome hopefully will be really enhanced access to useful data and the data that people are looking for. We really hope that we can elevate the data producers. So making it's hard to see, but at the bottom there, we've got this really specific how to cite, and it cites the original data producer. We've also got now the functionality to have news articles at the end of every country page. So if you have, once you've published once the Nepal XAT has been finalised, then please shoot me a message. There's a button at the end of every page so we can say, oh, there's a new XAT in Nepal, and that will link there. When there's a new RAB, there'll be a little news item at the bottom of every page. We've got some news in there at the moment, but have a look at your country, and if you have relevant research, then please fill in the Contribute to the Vision Atlas form, and then we can pop that on there so that other people have access to that as well, and people don't have to go through all of that searching and trying to find those articles. And the other outcome that we hope to achieve is flexibility in what we produce for users. So we've got the high-level overviews for advocates and policymakers who want just the top-level findings, and then really detailed data sets for people who want that. We really wanted to make country-level data easier to find. There's a new feature which is a country comparison, so you can look at a country and then select any other country in the world and compare vision loss rates and explore workforce or any other aspect on the country dashboard. So we're really hoping that this will help the sector to speak with one voice. There's a lot of data out there, so being able to speak with one voice will really help us in terms of our collective impact and working together and demonstrating working together and advocating for what we're doing. And we're also really hoping that this will help policymakers and academics and governments have the information that they need. So, and it's also mobile responsive. So please, when you get a chance, I don't want to interrupt the session, but please take a look, visionatlas.iapb.org. As I said, this is a pre-soft launch, so if you find any bugs, please let me know. There will be bugs with any new tool, but please let me know what you think and if you've got anything to contribute. Thank you so much. Oh, sorry. And a big thank to our sponsors. Some of you are in this room. This could not have been possible without the sponsors and the data contributors. The Vision Atlas is nothing without these data contributors. So thank you so much.
Anthea, that's terrific. Thank you so much. Really exciting, isn't it, to see what's coming along? Questions from the audience?
I think the Vision Atlas is a really cool thing that the eye care sector can show off. Thank you. So a couple of questions. One is um, uh, because not like RAB studies, no, some maybe even 10 years old. So do you provide like a projection, or do you have the option for us to see like what could this be? Some kind of
We, at the moment on the data dashboards, we just show where RABs have been done and then direct people through to RAB World, where all the RAB data is. At the moment, we're just using the data from the Vision Loss Expert Group to talk about country estimates of vision impairment and blindness and the latest causes data. I think we'd have to have conversations with RAB World about
yes.
projections. Projections or trends over time. That would be a whole body of work, but I think we're well placed to be able to collaborate on some of those things now.
And the second question is, there are a lot of articles that are produced which have great visualization. One is the Lancet, the paper that has this bubble chart on like ophthalmologists per million. So I'm just saying that as an example, but there are many like that. Would you also bring that to the Vision Atlas so it's all in one place, or is all visualization only produced by the Vision Atlas group?
We don't want to take over everybody's work.
No, just so that it's because you're anyway attributing it.
Yeah.
So that
we would love to be able to work with people and say, hey, we've got an idea for a great story. We've got these tools. Let's work together and develop a great dashboard on workforce, for instance, and work together to develop those visualizations, have it co-produced and co-branded. So we're in a position to do that now. So if you have ideas for fantastic data stories or dashboards, then we're in a position to do that now.
Time for one more question before we have a general discussion.
Just an interesting thought, like now that you have the baseline data from all the different sources, could you probably have plans to have specific data sets for niche problems like ROP or expanded data on diabetic retinopathy? Because these are now they're in the nascent stages, and you will have data piling up over probably the next couple of decades. So it will be a good starting point now, and then look at it from those perspectives.
Exactly. Now that we have the, I guess, flexibility and agility to add in dashboards or, data stories, then I think it will be important to be able to broaden out from, cataract and refractive error and build more, consolidate more information around some of the other challenges. Great idea. Thank you.